Today I want to draw your attention to what I think is a pioneering project that we're attempting in Canada. It's called the Canadian Index of Wellbeing, or for short, CIW, and it's non-government. It's based on the premise that what we count matters, especially when we seek to build a better country.
One of the things that really excited me about the Canadian Index of Wellbeing and the potential that we saw was that it was really a big picture tool that connected the dots between the determinants of health equity, and the impacts on the things that we care about, people's lives, the communities, the systems. But it did so on using language that people really cared about. And as someone who was involved with the Resilience Collaborative, I'm just amazed at the uptake by our sector, all of the many different ways that it's been used.
First thing I want to do is to congratulate the community health centers in Ottawa. The leadership that they've shown in terms of the CIW, the leadership that they're shown in terms of saying, look, evidence-based policy is what determines good policy, is really important, obviously for Ottawa, but it's important for the rest of the country. And my own belief is that government policy, which is not based on evidence, government policy which doesn't build on results, fundamentally isn't going to work.
In a city like ours, you can really begin to believe that everything is always okay for everybody. The reality is that there are signals out there, and this report will indicate it, that tell us that we need to give attention to certain issues. And so I want to thank the authors, I want to thank everybody for the report.
At the end, we are going to leave you with this. This is called the Be Well survey. So we'll ask you questions, for example, about your social support, how many close friends you might have, your sense of belonging in the community, because perhaps we can actually get you connected to groups.
We took this notion of an idea to use this, and I brought it up early on in our Health Links work with our steering committee, which is a couple of hospitals, the First Nation, the Francophone community, the LIN, of course, Health Quality Ontario, Community Care Access Centre. That's our steering group. And they saw right away, I think, that the CIW is such a broadly based tool grounded in good research that is a counterpoint to the usual measures of progress that are economically based. It made sense.
The Be Well survey is used to identify what other social determinants of health we can assist the client with. The client was able to identify transportation, food, and social support as being important, but it helps us identify other areas that might be important also that we need to set goals around.
The exciting opportunity in Grand Bendon area is that as they've developed that common vision that they want to work on connected rural communities, they've recognized that it really is a 10-year action plan, and that we're looking for strategies using the Be Well information together to be able to leverage change.